Personality and temperament is largely shaped by environmental and surrounding factors. This is largely shown in infancy and children who are taking in their foreign environment and learning as they go. Their upbringing and surrounding factors can have a large impact on their whole of their personality and traits. But are there certain factors that contribute to this? Areas of developmental psychology research have done studies to see if prenatal stress correlates with temperamental and physiological traits in infancy and childhood, or rather, if certain genes are heritable. Measures of early temperamental qualities around age 3 has been shown to predict personality traits in adulthood. Kagan, Resnick, and Stidman did a study in 1988 to study the influence of genetic factors on shyness in children and whether environmental factors played into that as well. They used children between 3 to 7 years of age and observed their physiological variability as well as their reactions to unfamiliar situations. What they found is that there is a greater physiological reaction among children who are shyer and thus put them in a category where inhibited children are born with a lower threshold for limbic hypothalamic arousal to changes in the environment that they are not familiar with. While environmental factors also play a role, this proves that there is indeed a biological basis to temperament and genetics are involved. Gortmaker, Kagan, Caspi, and Silva did a study in 1977 investigating the correlation between the amount of day length a pregnant woman is exposed to and how shy a child born turns out to be. They used 192 trained interviewers on children aged 2 to 7, and measurements of shyness were conducted using in-home interviews. They found that a quarter of shyness prevalence can be attributed to the times of reduced day length, and that when gestation occurred during months of minimal day length, prevalence of shyness was higher. This further proves the biological basis of certain temperamental traits. Following up on the Kagan study of shyness, Gortmaker's study suggests that the daylight procedure could influence the fetus's developing central nervous system, giving them potential distinctive effects on embryos that possess a specific genome. A study by Gartstein and Skinner in 2017 focused on prenatal influences on temperament development and found that information from the environment is carried over to offspring through hormones that occur during prenatal stress. And it happens not only in humans, but across multiple species. The higher the rate of stress, the increased amount of cortisol was produced, which in turn produced behavioral effects such as stronger physiological stress reactivity and anxiety-like behaviors. While there can be benefits to alterations in gestational cellular structure, there are also compromised health outcomes when it comes to altered genes, which can last into adulthood. In addition, a 2019 study by McLean, Cobham, Simcock, Kildea, and King studied the effects of prenatal maternal stress on childhood anxiety symptomology. They delved into the effects of flood and natural disaster-related stress in pregnancy and how it correlated to toddler temperament. They used maternal reporting measures for both 16-month-old toddlers and 4-year-olds and found that maternal hardship during pregnancy was associated with anxiety symptoms in the 4-year-olds. With all this in mind, we now know that 1, certain temperamental traits in infants are biologically based, and 2, prenatal stress can have an effect on the outcome of the child. So now we wonder, how does prenatal stress affect neuroticism in children? While there has been research done to discuss the effects of prenatal and maternal depression and anxiety on infants, there is little to no research done about subjective distress on pregnant women and the effect it has on the infant that is birthed. I would like to investigate the correlation between subjective distress, specifically domestic violence in the home, while the woman in question is pregnant, and the effects it has on how high the neuroticism scale the child turns out to be. High neuroticism traits include shamefulness, emotional liability, depressivity, helplessness, and insecurity. I believe this is important research because there are several studies that talk about how temperament in infancy can sometimes lead to psychopathology later in life. My hypothesis is that I predict that subjective prenatal stress through domestic violence in the home will result in a higher amount of cortisol being produced, which in turn will relate to a higher average amount of neuroticism and temperamental traits in children 3 and above. Using similar methods to Gortmaker and Al studies and McLean and Al studies, we would like to use maternal self-reports during the midpoint of gestation, which is when the migration of critical neurons happen, and then send in trained interviewers at 16 months and then again at 3.5 years of age.